Hi, could you please introduce yourself?
Hi, my name is Markie. I'm a nurse practitioner at Northwestern.
And where are you from?
I was born in Arkansas and moved to Illinois at the age of 5, and I was raised here.
And who was your role model growing up?
So when I think back to, when I was growing up, I idolized Christy Yamaguchi. You know, young, smart, the best at what she did. She was my idol.
And what motivates you?
I have a young family. I think my kids are my main motivator right now. My relationships, friends.
And what's one thing you want people to know about you?
I'm a kind and caring person. I think that's what I want my legacy to be.
Mm-hmm. And how do you typically start your mornings?
Coffee, lots of coffee, getting my kids ready and myself, and it's usually like a rush out the door.
Understandably. And what specialty or subspecialty are you in, and why are you in that?
Yeah, I hold board certifications in acute care and women's health, and currently practice in oncology with, I would say, a passion for gyn-onc.
And what type of patients do you normally see?
So I see oncology patients, solid tumor. Majority of our patients are thoracic tumors or thyroid, gyn-onc, and we have a small number of other solid tumor patients.
Mm-hmm. And in your opinion, what are some traits that make a good healthcare professional?
I think being patient, listening to your patients, being calm and kind of considering the whole picture make for a good healthcare provider.
And what aspects of practicing medicine do you feel like is the most challenging for you?
I think it's the things that come outside of the patient-provider relationship. So like insurance, like institutional rules, things that kind of put barriers around how you can care for your patient.
Mm-hmm. And I guess in contrast to that, what aspects of practicing medicine do you find the most rewarding?
Building relationships, so getting to know somebody, kind of like who they are, what they're about, what their desires are, how you can help them, because it's not one size fits all. You have to kind of tailor how you treat somebody based on how they want to be treated.
And how do you collaborate with other healthcare professionals, such as physicians and nurses?
So my current role is very collaborative. So we have team meetings, we meet with physicians and nurses to kind of come up with a game plan that's unique to all of our patients. So we have those in-person meetings, and then we also collaborate with other specialties, and we do that by calling them on the phone, sending them messages, lots of communication.
And how do you build trust with patients in your care?
I think it just takes time. I think you ask them questions about themselves, kind of get to know them and what they want, what their desires are, how they want to feel, and it just takes time, kind of slowly. You kind of become part of their healthcare team, and then sometimes even part of their extended family.
And do you have any special tips or tricks when it comes to caring for patients?
Tips or tricks? I think just listening. I think that's a huge thing, because you can kind of have an idea about what's going on with the patient just by what you're reading on the chart, or what their numbers are before you even walk into a room. And then you sit down with them, and it can change the whole picture. So I think you just really have to be there with the patient and kind of gather that information from them.
And how do you relax after a long day of work?
My kids are really good at kind of taking me out of this world. So I would use them as my answer again. But, playing with them. I also like to read and kind of just talk to my husband, relax.
And yeah, what are some like hobbies that you like and enjoy?
Yeah, so I like to read. I love to travel. Hoping to get back into that as my kids get a little older and COVID gets a little less serious. So I would say those are the two big hobbies that I have right now in my life.
And what is the greatest lesson you learned from your overall medical experience?
Um, you're never done learning. I think I probably learn something new every week, if not every day that I work. I think you just have to be open to that and know that there are things that you're going to learn. You're not going to know everything. And I think that makes you maybe a safer provider too.
What's a challenge you feel healthcare professionals face today?
I think there's a lot of things put on healthcare that are outside of the provider-patient relationship. So things I mentioned before, like the constraints that insurance puts on you, or institutional things, rules, and patients are living longer. They're more acute. We see, much bigger issues than we probably did 30 years ago. And as we learn more things about healthcare, it opens up more questions, more doors for the unknown. So I think there's, we learn more, but there's always going to be more that we have to learn.
What is one piece of advice you would have for aspiring healthcare professionals?
Take it easy on yourself. Listen to your patients. Like I said, you can't know everything off the bat. You have to be open to learning new things and being kind to yourself.
Yeah, thank you so much.
Yeah, no problem.